Good evening, friends. Welcome all to another session from Dr. Basavaraj sir. We are awaiting long to hear from Dr. Basavaraj sir. Today also he will open very useful healing modalities to all the healers. With the support of all of you, on behalf of Yoshi's Kerala Group, I am inviting Dr. Basavaraj sir to this platform. Good evening, sir. Welcome, sir. We all are awaiting to hear from you, sir.
Good
Thank you
evening,
for your
ma'am.
kind presence, sir. Thank you.
Thank you. Good evening. So we are going with a series of lecture on acupressure. If you have any questions, please welcome. In the last session, we discussed about breathing disorders. So definitely, breathing disorders, it comes due to excess of yang as well as yin. So sometimes yin deficiency or yang deficiency, both leads to the breathing disorder. Especially when blood is less in the body. So when heart blood deficiency happens, so the neighboring organ for heart is lungs. So obviously that leads to the breathlessness. And yang deficiency, especially kidney and liver yang deficiency, leads to the breathlessness in the lungs. Normally in both the cases, yin and yang deficiency, we normally go for some relief method, taking some Asthalin and all. No doubt you can take that for a relief. But by moisturizing your lungs and enhancing the chi flow to the lungs, so definitely if anybody taking inhaler for even decades together, so they can leave that medicine and they can start a drugless method of living. So even you can enhance a Sujoka reflex of lungs by applying some garlic paste or ginger paste, depending upon the severity of the yang deficiency. If it is a yin deficiency, you just apply any leaf on it, like coconut leaf or palm leaves, even banana leaves. So that increases the yin energy in the lungs. So in this area, overnight you can apply whether it depends on yin or yang deficiency. How to identify yin and yang deficiency in the lungs? Because many of the kids, even elders, are suffering with dust allergy, bronchitis, breathlessness and all. So how to identify the breathing problem belongs to the yin deficiency or yang deficiency? Anybody? No doubt, a tongue is the one best method to identify yin and yang deficiency. Just below the tip of the tongue, in this area, you just check it out. If it is a yin deficiency, you can find some cracks there. If it is a yang deficiency, you can find some saliva accumulation, some white coat there. There's one method. The second method, even you can ask the patient itself. When your breathlessness or a cough or any lung symptoms will increase, few people will tell it happens when they climb up first or second floor, third floor. Definitely. So you are unable to climb means your yang is deficient. So then you can raise the yang by treating kidney and liver meridians. If it is happening due to indeficiency, so normally some upward cough will be there, because when enough in energy is there in the lungs, it normally pushes the chi and water downward. So when there is a indeficiency in the lungs or yang deficiency, so normally some whooping coughs will come, even in between the talks and in between their when they're talking, normally they cough. So that is also a yang deficiency. If the patient complains they're getting very less sputum, that too pale yellow in color, then you can consider that as a lung indeficiency. And even aggravation also very, very important. Few people are aggravating due to dust, and few are aggravating due to the weather changes. Because so normally lung is a primary organ which most of the time exploring to the environmental changes. So due to that, normally many people, they're usually get into the breathing disorder when they explore to the dust, sunlight, even for pollens kind of things. So definitely medicine may give you a relief, but in this acupressure and color therapy method, you can get rid of it. So even food plays very important to make sure that if it is a yang deficiency, don't take cold food. If it is a indeficiency, don't take too much dry and spices. So yesterday, one lady called and she visited clinic 2 months back for her son adenoids. So due to the adenoids are swelling in the throat, so his son is always opening mouth and breathing throughout the night like this. They consulted. I just conclude that so in that guy, the stomach yang is very low. Then I given few points to raise stomach yang energy so that the stomach is a primary chi. So that is responsible for digesting the food. With that concern, I just given stomach 36 and I given some pressure and given some moxa. And I asked the lady, so what food you are giving? Then regularly she told when morning and evening 1 cup of milk and afternoon and banana fruits and some seasonal fruits and some sweets and all she told. Then I just told the primary culprit for the adenoids is stomach coldness. Even though you treat any points or any colors, by the next day they are giving sweets, especially made with sugar. And if they are giving with especially banana and some cold fruits like musambi, banana, and the fruits which is stored in the refrigerator. What happens? Obviously, all sweets are in. So when you give a cold stuff and sweet stuff, automatically your stomach become cold. The jetarachne has to flare up and warms the throat. So most of the time, the throat issues due to stomach coldness. It may be adenoids, it may be tonsillitis, it may be a glacitis thyroid, and throat swelling, goiter, The most of the throat issues, it's due to stomach coldness. Sometimes stomach heat also. When stomach heat increases, you feel throat burning sensation. And some upward cough will come when stomach heat is there. But 70% of the people, they are suffering with stomach coldness. The best thing to stop mouth breathing, bronchitis, adenoids, tonsillitis is stop giving cold fruits. In that, grapes and banana is the number one. And second place goes to the guava. Normally we give to the kids. And the seasonal fruits, sometimes musambi juice, that also makes your stomach cold. If you are a pitta nature, excess body it is there, then you can take guava, banana, and grapes. But for the kids, no, the yang is not completely developed in the body. So that lady called after 1 year and she's telling, very thanks, sir, my kid is sleeping by with breathing in the nose and not opening the mouth. Very, very happy. I told the credit goes to you only. You stopped banana, you got result. So banana, guava, grapes. You can give kids if your kid has young energy. Otherwise, stop it. Even though their excess yang is there, give those fruits in between 11 to 1. That is more important. So that's what, especially if comes to the grapes, my suggestion is don't give. Even they're asking, even oftenly their body yang is good. So 2-3 times you have to wash that grapes in the salt water. Then you can give. Because it's a lot of pesticides and that is making your stomach not only cold, it's filled with a lot of pesticides. So one disadvantage of having these type fruits and vegetables is, so that is not only killing the pests, that some worms on the vegetables and fruits, it is also killing some healthy bacteria which is required for your food absorption. So many kids, they're eating here and there everything, but they end up with a nutritional deficiency. So one of the cause for nutritional deficiencies, there is no healthy bacteria. So due to that, many kids are food absorption is very low. Slowly, India is becoming like US. You're killing everything and taking food, no healthy bacteria. Again, you're taking some yogurt and something to fill the healthy bacteria again. So instead of that, give your kid the desi A2 milk, what we call desi cow milk or buttermilk. That is the best source of that healthy bacteria for your kid. So most of the times, problem will be there in our plate only. But we visit the doctors. Just correct the food. Just correct the food. You can see your kid healthy. all my students in last 12, 13 years, Basavaraja Academy trained more than 5,000 people across India and other countries. In all my students, they are not giving any medicines for the kids. So that's how we trained our students to treat themselves and others. This is more important because we elders can withstand some temperature variation, breathing disorders, and some elimination problem. But for kids, it's very difficult. Normally, if small things happens to our kids, we are afraid of taking risk and rushing towards the doctors. No doubt, in emergency you can go, but most of the time, my suggestion is your food never heals your kid. I'm sure. 90% of the illness for your kid, it's because of food only. And all 90% of the illness can be corrected with by changing the food and by just balancing energy with colors and acupressure points. Some other 10% will be there. It may be genetically or it may be chronic. That we cannot address, I will agree. But 90% is a good percentage. Means out of 10, you can heal 9 kids. That's even that success rate is not there even MBBS, MD, pediatric doctors also. You have that. 90% success rate. Leave about me. I'm telling about my students. They are doing this magic. For this, you need to understand a few things, how this acupressure works, what is the perspective of TCM, and how we can take the food to nourish our body and mind together. So this is the science. So we call it as a traditional energy medicine. In last 4 5 years, we are also teaching in Joshi's Kerala group. I think we finished 3 4 batches. Every year, one batch we do for traditional energy medicine. Very pinpoint, accurate diagnosis and as well as treatment. So through Joshi's Kerala group, we are producing around 150 to 200 healers every year. Many of our students are doing magics across India and other countries. Anyone wants to share your magical touch after learning with the TEM? Because many students undergone this training about TEM. Any old students attending this class? Yes, Sharanjit Kaur.
Good evening, sir.
Good evening.
Sir, it is very, um, I want to say, very, very wonderful thing that I just touch. I have so many problems as my age is 56. So many time I have been leg pain. I just touch for a while and pain is gone.
Super.
I'm, I'm one of my teacher. She's whole day crying. Working as a teacher. She's whole day crying. I have pain. I saw that it is in the which region. I just touch. I told her कि my sir say don't touch any person. But today I cure you with my energy. Oh, she's very much thankful. Yeah, I am crying for this whole day pain, and you just touch and remove my pain. And so many with other peoples also.
Wonderful.
Thank you,
You're
sir.
doing
Thank you
magical.
for a wonderful education that you are giving to us.
Thank you, ma'am. Thank you.
Thank you, sir. Once again, thank you.
Thank you. See, it's a great thing. Learning, we teach only around 25, 30 points. With that, you do very accurate diagnosis and you can do magics. Yes, Abhi.
Hi, sir.
Hi.
I have completed term during the last batch, and after that, I have not given any medicine for, especially for my kids. I have twin boys, and whenever they have any issue, I try to understand the root cause. Like, is it due to yin or yang reason? And if I find if it is due to yin reason, I try to do with the food. And most of the time, with food itself, problems are cleared. One day I'll wait with food. If it is not cleared, I'll apply the point. So
That's
that is a great thing, because with food, if we are telling to some other people, it's very difficult to believe. But we are experiencing the magic of this food, means this energy. If we are able to understand the energy of food in young, most of the time it is successful, and it's great. Before that, I used to have homeo medicine and all. During seasonal change, the kids used to have some kind of cough, this thing and all would be there, no? But after term, alhamdulillah, and thanks to my sir,
Thank you, Abib.
really good thing. Thank you.
Thank you very much. So Abib is taking, Mohammed Abib is taking care of his kids. It's just changing the food and using few points of TM. So that's what I'm telling you. Don't feed the kids with chemicals. I'm telling you are taking is a something I'm not agree with the elders itself. It's making more damage. How can we give that to the kids? Because one major common mistake we normally do with kids is normally body is expressing its symptoms. We are suddenly stopping it. So that causes some other major damage to the body. Yes, Joginder.
Priyadarshini is there, sir.
Yes, Priyadarshini.
ಸರ್ ನಮಸ್ತೆ
Yes.
ಸರ್ ನಾನು ಕನ್ನಡದಲ್ಲೇ ಮಾತಾಡ್ತೇನೆ
Yes.
ಸರ್ ನನ್ನ ಈ ಒಂದು ವಾರದ ಎಕ್ಸ್ಪೀರಿಯನ್ಸ್ ಏನು ಹೇಳಿದ್ರೆ ಒಂದು ಝೀರೋ ಸ್ಟೇಟ್ ಮೆಡಿಟೇಷನ್ ಅಲ್ಲಿ ಆದ ಒಂದು ಎಕ್ಸ್ಪೀರಿಯನ್ಸ್ ಯಾವಾಗ ನಮ್ಮ ಅಯೋಧ್ಯೆಯ ಇದಾಯ್ತು ಮೋದಿಜಿ ಹೋಗಿ ಇದ್ ಮಾಡಿದ್ರು ಆ ದಿನ ಅವರು ಕಿರೀಟ ಹಿಡ್ಕೊಂಡು ಹೋಗುವಾಗ ಒಂದು ಝೀರೋ ಸ್ಟೇಟಿಗೆ ಹೋಗಿ ನನ್ಗೂ ಸಹ ಅಯೋಧ್ಯೆಗೆ ಹೋಗ್ಬೇಕು ಅಂತ ಹೇಳೋ ಒಂದು ಥಾಟ್ ಹಾಕಿದ್ದೆ. ಅದು ಮೊನ್ನೆ ಕಾಶಿ ಮತ್ತೆ ಅಯೋಧ್ಯೆಗೆ ಹೋಗುವ ಅವಕಾಶ ಸಿಕ್ಕಿತ್ತು, ಝೀರೋ ಖರ್ಚಲ್ಲಿ ಸರ್. ಆಮೇಲೆ ನಾವು 24 ಜನರ ಟೀಮ್ ಹೋಗಿದ್ದೆವು ಫ್ಲೈಟ್ ಅಲ್ಲಿ ಹೋಗುವಾಗ ಒಬ್ಬೊಬ್ಬರಿಗೆ ಒಂದೊಂದು ರೀತಿಯ ಎಕ್ಸ್ಪೀರಿಯನ್ಸ್ ಆಗ್ತಿತ್ತು. ಒಬ್ರು ಕಿವಿ ಮುಚ್ಕೊಂಡು ತಡಿಲಿಕ್ಕೆ ಆಗ್ತಿಲ್ಲ, ಲೆಫ್ಟ್ ಸೈಡ್ ಪೇನ್ ಅಂತ ಹೇಳಿ ತುಂಬಾ ಕಷ್ಟ ಪಡ್ತಿದ್ರು. ಸೊ ಅವರಿಗೆ ನಾನು ಲಿವರ್ ರಿಫ್ಲೆಕ್ಸ್ ಪ್ರೆಸ್ ಮಾಡಿದೆ ಮತ್ತೆ K3 ಪಾಯಿಂಟ್ ಪ್ರೆಸ್ ಮಾಡಿದೆ. ಸ್ವಲ್ಪ ಹೊತ್ತಲ್ಲೇ ಅದು ಕಡಿಮೆ ಆಯ್ತು. ಇನ್ನೊಬ್ರಿಗೆ ಅಲ್ಲಿ
talk in English, that will be helpful for others too.
ಓಕೆ 2 ಪಾಯಿಂಟ್ ಹೇಳ್ತೇನೆ ಸರ್. ಅಂಡ್ ಅಲ್ಲಿ 2-3 ಕಿಲೋಮೀಟರ್ ನಡಿಲಿಕ್ಕಿತ್ತು ಅಲ್ಲಿ ತನಕ ಮುಟ್ಬೇಕಾದ್ರೆ. ಸೊ ಕಾಲ್ ಸ್ವೆಲ್ಲಿಂಗ್ ಬರ್ತಿತ್ತು. ಸೊ ಲಿವರ್ 3 ಪ್ರೆಸ್ ಮಾಡಿದ್ದೆ ಸರ್. 5 ನಿಮಿಷದಲ್ಲಿ ಅದೆಲ್ಲ ಕ್ಲಿಯರ್ ಆಗ್ತಿತ್ತು. ಸೊ ಇಂತ ಒಂದು 24 ಜನರಿಗೆ ಸಹ ಈ TM ಬಗ್ಗೆ ತುಂಬಾ ಕುತೂಹಲ ಆಗಿದೆ. ಎಲ್ಲರೂ ಸಹ ಹೈಫೈ ಅಲ್ಲಿ ಇದ್ದದ್ದೇ ಎಲ್ಲ ಕಂಪನಿ ಓನರ್ಸ್, ಇನ್ಸ್ಟಿಟ್ಯೂಷನ್ ಪ್ರಿನ್ಸಿಪಲ್. ಸೊ ಅದೊಂಥರ ಒಂದು ಖುಷಿ ಅನ್ಸಿತ್ತು. ಥ್ಯಾಂಕ್ ಯು ಸರ್. ಥ್ಯಾಂಕ್ ಯು.
Thank you very much. So she expressed that experience in her mother tongue. So whenever he feels any suffering people she see, just she's pressing 1 or 2 points. For example, many people when they are going in the jet, in aeroplane, normally in the flight we get ear block and we'll get ear pain. This due to a kidney coldness. Just press K3 overall going in the flight and feeling the ear blockage. It just vanishes within 5-10 minutes and it never comes again. So like that, many things we can learn with single point. We can do the magic. Yes, Joginder, what's your experience with the TM?
Namaste, sir.
Namaskar.
Yeah, I have a good experience with the sleep problem. Um, every day I just put the black color around here and green color over here on the below the nails. It really helped me in the sleep, and I told so many people, so they are also using it. But the only thing is that sciatica pain is still disturbing me sometimes. It uh, it was uh, it was a painful experience for me for the last so many years. But I put the GB40 points on the middle finger, GB40, with the with the seed, and it helped me. But again, it started again, so I'm really
Now,
tired today.
sciatica, it happens due to a liver or spleen or kidney coldness. So if it is sciatica
Okay.
is there, you should not use green. First step.
Oh,
Don't use green. Okay.
okay.
Okay. Instead of that, to warm your lumbar and relieve the pain, left hand ring finger, third joint, you just apply sky blue.
Mm-hmm. Uh-huh.
So that
Oh,
increases,
sky
if you
blue.
apply sky
I
blue,
thought it's black.
no, if you apply sky blue, so it increases the circulation to the lumbar area.
Uh-huh.
When circulation increases, automatically chi and blood rushes to the lumbar area, then healing, self-healing starts. So slowly within 1.5, 2 months, completely you will cure. Okay. Thank you.
Okay. Thank you, sir.
Thank you very much.
But I have a good experience with the sleep.
Super. Thank you. Continue, Black.
Okay. Thank
Bhagyashree.
you.
Thank you.
Sir, namaste.
Namaste,
Bhagyashree, sir.
ma'am. Namaste.
Namaste.
How are you?
Sir, I'm fine. Sir, last 2 years, we not went to hospitals. If fever come, any issues, we are treating, sir. With naturally, we are healing, sir.
Super.
Sir, thank
No
you so
medicine.
much for that, sir. We change food also. We change food and lifestyle we change, so we are not getting here what this is also, sir. We are treating others also, so it is very good
That's
results, sir. For TM points, we are using TM points, colors, acupressure points. It will give,
super.
sir, good results, sir.
Wonderful.
Thank you, sir.
Continue
Thank you
your
so much.
work, Bhagyashree. All the
Thank,
best. And
thank
this
you
is a
so much, sir.
lifetime skill. And once
Yes,
you
sir.
learn
Yes, sir.
TM, that's
Yes,
that
sir.
30 points what we teach.
Yes,
It's a
sir. Yes.
lifelong asset.
So we are treating some many issues. Yeah, now clients also coming, sir, for this what drugless therapy for
What's
this.
your qualification?
Sir, BA, sir. I did BA.
So she did BA and treating people more
And
accurately
yoga
than any
instructor
MD.
also, sir. I am
Huh?
yoga instructor. So now this TM we are treating, sir. TM points, acupressure,
Super.
this colors.
Results. So normally people are coming to you after visiting doctors only, no?
Yes, sir. Yes, sir.
So for them you are giving results. That is
Yes, sir.
great.
Yes, sir. ಎಲ್ಲ
Super.
ನಿಮ್ಮ ಆಶೀರ್ವಾದ ಸರ್. ಥ್ಯಾಂಕ್ ಯು ಸೋ ಮಚ್.
Thank you very much.
ಥ್ಯಾಂಕ್ ಯು ಸರ್. ಥ್ಯಾಂಕ್ ಯು.
Good
Yes,
evening, sir.
good evening, Purnima.
Good evening, sir. Good evening. Thank you very much, sir, for this wonderful treatment. And like I had guests at home, and they were having one of them was having severe bloating and uneasiness. He said, I cannot have the lunch because I'm having some problem. I said, okay, wait for some minute. I gave him stomach 42 sedation. And after some time, he's telling, you can serve my lunch also. I'm ready. I said, what? All of a sudden, then he's like, no, my stomach problem, everything is gone. Now I'm happy. I can have my food. So that is the wonder of the treatment, sir.
Yeah. So many times due to gastritis, many people are suffering
Yes.
with excess of yang energy in the stomach. Just
And
let out
instead,
that stomach. Either you can
yes, sir.
treat stomach 42
Yes,
or
sir.
stomach 40. The
I
excess.
even I applied green color, sir, dark green color here, and
Oh,
within no time the bloating also disappeared for the other person. So it is a really wonderful therapy, sir.
yeah.
Even my sister-in-law, she used to never sleep in the night. Like every day, she'll be complaining, I'm not getting sleep. But yesterday, she is telling, I'm sincerely using the methi seed. Like now, also, I am still having black color. So she is also applying black, and then she puts the methi, and she said, I don't miss out. I said, stop in between. She said, no, I will not get sleep. So she's sincerely doing it. So thank you
Super.
so much, sir. Wonderful, wonderful.
Thank you very much. Continue your work.
Yes,
So
sir.
definitely so many times where we are unable to get the results with medicines, but we
Sir.
can get it through acupressure and color. The here only thing is the accuracy of diagnosis, whether it is yin or yang, on which meridian. If you are able to do it, definitely no scanning, no blood test, nothing is required. Without that, you can diagnose and you can treat the people. Wonderful.
Very much, sir. Thank you.
Yes, Kamal.
Hi, sir.
Hi.
Good evening.
Good evening.
Yeah, I'm sorry it's a bit more noisy here. I'm sorry I missed this. This because I haven't been well actually. Was waiting for this seminar, and I had really not such a bad fall on my back. It's so painful. Now I stood in hospital for 12 hours. Thank God there is no fracture, but the pain is. I don't want to take paracetamol, but now it's going into lower jaw. The sensations of pain, and so I really try to find best way to treat this myself here. Any TEM or auricular, whatever. It's really, really bad. So I couldn't work.
Super.
Anyway, it'd be nice if you could
It is
help me with that.
PM and as well as auricular points.
Is it best auricular?
Super.
Hello?
Yes, tell me.
It's best auricular.
Auricular.
Yeah, I think I'll just make my mind see what if the protocol is right for me. Just instinctively see what's connected and try. It was really horrible. I really wanted more, and I've been various doctors now because really never happened. I was just feeling a vertigo, and I fell back, and it just the hips and the sacrum. It's horrible. So yeah, another thing. When are you starting the English classes now? It has been too long to wait.
Yeah, we will start soon. If you have a hip joint pain, just apply once methi seed on SP6 point.
You mean what? And then which joint is that?
It is SP6 point. If anyone is having hip joint pain, just apply one methi seed only 10 to 15 minutes.
You
Your
mean
hip background
is
pain
that,
will vanish within 3 days.
was the middle finger? I was thinking about middle finger, right at the
Middle
bottom.
finger, apply one fenugreek seed for 10 to 15 minutes. Just do this. Definitely within a short period of time, your hip and femoral joint and sacrum. So normally that issues comes due to indeficiency because that is
Okay,
the
thank you so much.
structure it is holding the body. When yin is not sufficient in that area, you get the pain.
I
SP6
wish
that
somebody
is
from the
keep
group
the
send
yin
me.
energy there.
I wish somebody from the group send me where I put it and for how long. Because I'm a bit confused. I shouldn't be outside. I just came out to take some stuff from it.
Sure.
And I go back
Later you
home.
can apply and share your experience in the Joshi Scala group. Okay, thank you. Sure.
Taranpreet.
Taranpreet Kaur.
Bulbul.
Namaste, sir.
Hi, Bulbul from Orissa.
Yes, sir.
Yes, how the
Sir,
practice is going on?
sir, good. Sir, I want to come to Bangalore for practice. When will I come?
Sure. Just wait for 2-3 weeks. In the month of May, we are starting offline batch for 10 days. That time you can come.
Okay, sir. Sir, one lady having diabetes and she have mm, hiccups, vigorous hiccups. Then I gave her ST42. She take many medicines, but does not work. But after ST42, it reduced. But now she has a clot in her eyes.
Here, which area?
Inside her eyes.
Okay, so inside eyes, normally it's controlled with the liver as well as spleen. So normally hiccups, it happens due to spleen dampness. Just put one methi seed on SP9. So definitely your hiccups will vanish. Even that cyst also clears.
Sir, hiccup vanished before. She has more hunger and frequent hunger. So that's why I gave her ST42.
No, normally for a diabetes patient feeling a frequent hunger and stomach burning sensation, it's normally most of the time yang deficiency.
Sir, but she is very lean and thin.
If you're lean and thin, you can use K3.
Yes, sir.
Even that cyst will vanish.
Okay, sir. Thank
Okay,
you, sir.
thank you very much. So diabetes patient, you have to understand in the broader perspective. So that we will discuss in the upcoming classes.
Deeptisha.
Good evening, sir.
Good
So
evening,
I'm very glad that I did your class. It has been a complete different experience in last 1.5 years. And I've experimented with a lot of points, and 50-60% of the times it's been successful. 30-40% of the times there is still confusion whether it is a yang or a young yin problem. I'll give you a simple example of, for example, there are two in the class we attended. We saw that there is acidity before eating and there is acidity after eating, and after eating is because of the function, and therefore you do SP9 and it will start working well. But when we get into the details, we realize that because after the food we've eaten, there is heat created. Now because of that heat, there is this acidity that is happening. So now there is a confusion. Should we do SP9, which will increase yang, but the yang is already there and you're feeling burning sensation after the food, and also what is the first treatment we should give? So that's a problem. But when we attend the class again and again, and we hear your recordings again and again, every time that same recording has a different meaning. And so glad to kind of be associated with Basava, with Joshi's Kerala group. It has been a very different experience. Very good.
At least I think, Deepti, for you, one more class is required. So you join. For repeaters, very less fees will be there. So many times we misunderstand this. After eating food, I'm feeling stomach burning sensation, means stomach heat. So this may be more yang. No, that stomach heat or stomach burning, it is indication of stomach is unable to do its work. Because stomach may be a yang organ, but it's basically contains in the fluids in it. So due to that, That food burning sensation is due to a stomach chi deficiency. The best point, you can use stomach 36 tonification or aspirin sedation. Both will work.
Yeah. So one more request, sir. If we are able to take at least top 6, you treat 100 patients every day. If we are able to pick up top 6 problems that you come across in Basava, and probably share various diagnoses of the same problem, and you could probably have, say, like acidity only. And if people could have like 3 different or 4 different connotations to that acidity and the solutions to it. I think the live example, if you are able to do some 6-7 classes on that, muscle pull and common problems that we face every day, like there is a muscle pull, somebody's sleeping and there's a muscle pull happens, we give so many points, but maybe I'm giving wrong points, but it doesn't work, and then we have to experiment 3-4 times and we still don't know what worked.
Oh,
So if
most
we're
of the times, instead of thinking ourselves this point will work, and it's better to ask the patient his pulse and tongue. Will give you more information, especially pulse. So what we thought, how to measure yin and yang in the each meridian. So that will give you a lot of information. After that, just cross check once with the tongue.
Yeah.
So that will give you 80% of the that diagnosis. If you have still doubt, ask a few questions to the patient. That will confirm that, yes, this is the pattern. Then you go for point. Instead of, I can teach many things, you can understand in different way, you can apply the points, no doubt. But before applying thoroughly, you take 5 to 10 minutes with the patient. Follow this: pulse, tongue, symptoms. After all these 3, asking questions. You know how to ask questions. In each meridian, I given set of questions. Based on that, you conclude, give 1 point. If it is working, for example, if you given the point to raise the yang, if it is working, give similar points. If it is not working, just go to opposite side, raise the yin. So definitely each patient takes 1 or 2 sittings to analyze this. I
So
think
like yesterday, my mother had loose motions in the night because of the heat. So I gave SP3 tone. Now SP3 tone, and I gave on small
how
index
you
finger,
conclude
yellow and
it's
black.
due to heat? My question.
So smell, sudden, and temperature in Bombay, which is at 40. And all of these symptoms kind of arise in to give the yang excess in the
Have you
stomach.
checked the tongue?
Yeah, I did that also. Slight yellow, palish yellow coating, dry. So these 2 were there as the tongue
Have you
symptom.
checked right hand second pulse? That how you miss this?
So I don't know pulse diagnosis so much.
Okay. Okay, which point you given?
So I give SP3 tone.
No, you should never touch sp3 because it is not reducing heat. It is simply reducing the humidity.
Yeah.
If you want to reduce heat immediately, just
Stomach
go for
forgive.
LI4. It reduces the heat within large intestine within 5-10 minutes. Okay, so don't worry. You learned something you grasped from TM last year. So this year we are going in depth than last year. Definitely, you can much more things and you can attract the patients.
So, but thank you very much. Very nice classes.
Thank you, ma'am. Thank you. So thank you for wonderful feedback, Dipti. So definitely, we think TM is learning only 30 points. You learn like this, but it takes so much of effort and time. That's what many of my students are attending the classes second, third, fourth time. It's true. Many students are attending second and third time. Still, they're learning new things. So that's how it goes, because we spend more time on diagnosis and pattern analysis. So we think these symptoms may be yin or yang, but Each individual patient is different. So that's what any patient you treat with this method, don't forget to take pulse, tongue, and symptoms. All three you should take and analyze, and you should not confirm. By asking few questions to the patient, you have to confirm the pattern. Okay. So all the best.
Pulse, yeah, pulse.
Yeah. Good evening, sir. I have been attending your lectures. I have not yet joined the TCM course. I would love to. But yes, I have studied TCM, but my knowledge is not great. I think every day I get to know more and more as I get into more books. There is a question, sir. I have actually posted one picture in the chat. There's this lady who gets this red rashes with little swollen thing in between all over her face and body, and it's been there for few years now. It comes and goes. So I checked her tongue when she came to me, and it's dry and a little uh, pale pinkish pale, and has a lot of small cracks throughout from the stomach and the backward area, like not the front part of the tongue, but the back part of the tongue, very small cracks. And the face part where she has all these heavy rashes, um, it comes with itching, but the body does not have itch. It has the same very big rashes. So like she's tired of taking Allegra and taking everything. So I did SP6 toning and sedating ST36, as well as, because I thought it's more heat in her body, the
See,
stomach.
that's what many mistakes many healers are doing.
Yes, sir.
I'll take this example. If you take any of our TM batch,
Yes.
few students, they are just new to this field. They are learning TM, they are doing wonders. Second, you might have seen in the last batch, who are doing TCM, traditional acupuncture and Sujok and other methods, even for 10, 15, 20 years. They are also joining this. Okay, I think you have how many years experience?
So I'm practicing for 2 years now.
2 years. You started now only.
Yes, sir.
So this course, my suggestion is, even if you have 20 years experience, take TM course. If you have
Yes,
10
sir.
years experience, take TM course. Why? Why? Because this course is not teaching you which is there in the books, which is there in the syllabus, which is there in the universities. No. This is the only course in India which teaches with the research methodology. All my TM students across 20 countries. Today I'm putting one point. I'm telling you what happens in your body and mind after 3 days. I'm telling now only. I'm giving point. I'm telling what happens. So this is the level of accuracy in the TM. The second important thing is some do's and don'ts is there in every patient and every point. So that we should not forget. For example, to entire body, blood and chi is supplied by the stomach. That's where the food digests and converts into energy and spread throughout the body. Never ever sedate stomach 36. You should not sedate. The moment if one methi seed and stomach, it depletes the stomach energy.
Okay.
Okay. You just look at the lady, that stomach area. This is the stomach 1, 2. This area is a little dark. So that is indicating that our stomach is weak. Okay. So my suggestion is any given symptom is divided into yin and yang. So by seeing her face, so yin deficiency is there. Okay, so what you can do is just on this is LU7 point.
Yes, sir.
Just put one pepper seed on LU7. It will moisture the skin. By looking at the skin of the patient, it is dry.
Yes, sir.
You can fill the moisture by just putting LU7 point. Still, infection is not cleared based on the patient feedback. After LU7 tonification, what happened? After 2 days, after 3 days, after 1 week. Based on that, you can decide the next point. Whether you
So,
have to...
So her rashes keep changing. Like today, the picture is of today's. But when she came 2 days back, it was here on her cheek. And today it has come here on her forehead.
See,
So L2...
entire skin yang is taken care by lungs.
Yes, sir.
Don't worry, just put one LU7 point and you can press H8 point 20 times.
So which point?
H8.
H8. Okay, sir.
Just press 20 times. Okay. Don't do anything else.
Okay, sir.
Just wait for 1 week.
Yes, sir.
Thank
you so much.
Okay.
Thank you so much.
Thank you. So that's what I'm telling you. So I already know TM. I know already 100 points. Why I should join TM? This question has to be answered all the senior students. Because most of the senior students, they are all experienced. Still joined TM. Why? Because precision in diagnosis and point selection, and not only as a healer, your job is not completed after giving points or colors or putting auricular seed. Actually, healer job starts after giving point only. Carefully you have to observe what happened. What happened in the sleep? What changes in the bowel? What changes in the hunger? What changes in the skin color? So, healer job starts after giving points. That's what most of the time I'm not giving points to the unknown person. Many are texting me, give me point, this, that. I'm not giving. Who are in touch with me, who are able to follow me for next sitting, next consultation. Because I have to observe, I have to listen to the patient, what happened. If someone non-patient has just given point, he observe, he gaya boy gaya miss, what happens? For example, I given LU7. Okay. He's already having lung coldness. I don't know. I given LU7 and he's not returning back. What happens? The lungs coldness increases, nose black happens, and lungs filled with kapha and chest heaviness. Many more things will happen. I know what is the reversing point for it. How to reduce the lung coldness. I use some other point. Without following my consultation, how can I give? How can I understand whether after giving point lung coldness increased or reduced? So that's what the TM is, one of the unique course where we are selecting point after pulse, tongue, symptoms, and asking the questions, observing the patient face, color changes, and all those things. Even after giving point also, you are not forgetting the patient. We are eagerly waiting what happened. If you join TM course, you will learn from me maybe a 30%, 40%. Another 60-70% you will learn from the patient. I'm telling every point, every time I'm telling you something, how to observe the patient. After liver 1, liver 2, liver 3, H8, H9, H7, H4, stomach 36, stomach 42, stomach 44. How to observe? What happens after stomach 46, stomach 36 tonification? What happens after stomach 42 sedation? What happens after stomach 44 sedation? If you are able to observe that changes and note down that, you will be a very successful healer. Otherwise, you are just following the books, protocols. If one patient comes, put 5 points, 10 points. What happens? Even I don't know, patient don't know. If someone is click, happened. No click, oh, again try. Instead of that, you should systematically follow the patient. And obviously, it will take 2 to 3 months sometimes to solve the points. Yeah, sometimes 6 months to 1 year it takes to solve the problem. Not a problem. But even it is taking 1 year, 2 year, don't worry. But you are in the right track. Every week, every month, the patient is better than previous month. That changes will be there, no? Why many patients are taking time means it is not healer's fault, it is a patient fault. They are not creating chi energy by taking a native breed food. All are eating hybrid food. How energy will create in the body? Nothing. Acupuncture, auricular therapy, color therapy, and marma therapy, all these therapies are not creating energy. It is balancing energy. If stomach is weak, we are enhancing energy. How enhancing energy? It is taking energy from some other meridian and enhancing. The overall creation of energy, it happens with food only. So that's what in TM course we designed special vegetables and fruits and cereals and pulses for each meridian. What to take, what to not to take. If you do this, definitely you can do wonders. And of course, every TM is new. If you learn last year, the coming TM is carrying some more new things. Always we are learning and we are updating that. Okay, so definitely we'll learn together. We are researchers. We keep on learning and keep on spreading. If you meet me after 6 months, definitely some new things will be there from me. So that's what many students are attending again and again. Yes, Anu, what's your experience with the TM?
How are you, sir? I'm very good. I'm very happy that my hives is being completely cleared. Only 10% remaining. That's all. Thank you so much.
What it is cured, I didn't heard.
It is cured. I'm very happy for it. Only
What?
small bit of it is pending. Sometimes I get it. Just now also, I just got a small itch and a small bump like that. That's it.
90%.
Yeah, gone. Without any medication. I used to take 3 months continuously, the medication, small tablet every night, and I used to sleep after COVID. But now nothing is there.
Great.
Thank you.
And you're doing magic for others also?
Yes. I hardly meet couple of patients, but I have a question for you. I have got a blister on my eyes here. It's a it's not paining nor itching, nothing.
Sure.
Here, yeah, in my eyes. Yeah. Yes, sir. Left side.
Either one point will work. If it is you feel heat, L11 will work. If you feel it's cold, liver 2 will work.
Liver 2, not cold. Okay.
Just observe yourself. Check the if you want, you can you send me the tongue and you observe the pulse. Because it's a left side, maybe a cold. Because it's this area is a liver, spleen. Spleen heat also makes that bubbles and blisters.
Spleen heat maybe.
Yeah. So either L11 or liver 2 will give you the solution. Observe yourself either in or yang and choose the point.
Yes, sir, will do. But I want to heal a person. It's my mother-in-law, but she's 76 years old, but her knee pain is not gone. Every time, I mean, I had given her liver 3 gallbladders and all of it, but still the pain is still on the front portion of it. She walks around everything, but it
left or right?
Can help you with that. Huh?
Left or right?
Both in the front.
Front means it's a stomach only. Just put stomach 36 tonification.
Yes, sir, will do.
Okay, all the best.
Thank you. Thank you so much.
Thank you. So I created 5,000 dealers in last 12 years, and every state, every district. So definitely my aim is bigger and bigger. And nowadays how many patients and nearly 150 to 200 patients I'm treating every day. This is not the way to change the society. Okay, of course I treat. This is my job. But rather than treatment, so we are concentrating on the training. If I'm able to create another 300, 500 healers through Joshi Kerala group, so definitely it's a good thing. With that concept, why we are into training means we want to share our research. The Basava Academy is the one, it is sharing everything with its students. It never hides anything because we are all keep on learning the things. So see you soon in Joshi's Kerala group. I'll come back to you and we'll share much more things. Thank you very much.
Thank you, sir. Thank you so much. And we'll continue this session by thank you and good night. We'll meet again next time for the wonderful session from Dr. Basavaraj. Thank you all.